Hello viewers, here I am going to discuss overview on muscles of lower limb. This video will be helpful for you to know about the muscles located in each region of the lower limb, its nerve supply and its normal function. This video will help you for quick revision before examination, and also you can able to write very short answers in your examination. So please watch the video till the end. For better understanding of total muscles, lower limb is divided into four regions: thigh region, gluteal region, leg region, and foot region. Lower limb is specialized for support and locomotion. Lower limb attains stability at the cost of some mobility, whereas you can see upper limb attains freedom of mobility and at the cost of some stability. Hence, the lower limb muscles are bulkier and stronger than the upper limb. Apart from that, muscles of lower limb often cross two joints and they act equally on the both joints. So now we'll see that each region, what are the muscles, the names of the muscle, what is the nerve supply and action of these muscles. So coming to the thigh region, the thigh region is divided into three compartments: anterior, also known as extensor compartment; medial, also known as adductor compartment; posterior, also known as flexor compartment. So we'll see that each compartment, what are the muscles and what is the nerve of each compartment. Coming to anterior or extensor compartment of the thigh, the muscles of this compartment are sartorius. The sartorius muscle is that long, narrow muscle that forms a band across the thigh region, arising from the anterior superior iliac spine of ilium of the hip bone, arising from the inserted to the upper part of the medial surface of the shaft of the tibia, and it is having the various movements, and it produces flexion of the leg at the knee joint and flexion, abduction, lateral rotation at the hip joint. All these movements helps that affect the cross-legged sitting position, in which the heel of the one limb is placed on the knee of the opposite limb. Its position looks like a tailor often assume a cross-legged sitting position. So it's also known as the tailor's muscle. And other muscle is known as the quadriceps femoris. It is the largest muscle in the body. It covers that most of the anterior surface and sides of the thigh region. It is a composite muscle, and it is described with these four muscles, that is rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. The rectus femoris muscle, also known as the kicking muscle, it is arising from the two origin: straight head arising from the anterior superior iliac spine, reflected head arising from the groove above the acetabulum. The second muscle is known as the vastus lateralis. It arising from the greater trochanter of that femur and linea aspera of the femur muscle, femur bone. That third muscle is known as the vastus medialis. It occupies total linea aspera of the femur, and that intermediate muscle, it occupies that in between vastus medialis and lateralis, known as the vastus intermedius. It occupies anterior and lateral surfaces of the body of the femur, and the common tendon of that these four muscles, known as the quadriceps tendon, that inserted into the patella of that patella, and this tendon continues below the patella as a patellar ligament, and this ligament is attached to the tibial tuberosity. So these are all muscles of the anterior compartment of the thigh. Now coming to that medial compartment, also known as the adductor compartment. So all adductors are the unique muscles that cross the thigh joint like obliquely from anterior origin to the posterior insertion. So as a result, they laterally rotate the hip joint when the foot is off the ground, but medially rotate the hip joint when the foot is on the ground. So the muscles of this anterior middle or medial or adductor compartment are known as that adductor longus, and the adductor longus originate from the pubic crest and pubic symphysis. So inserted to the linea aspera of the femur, raising from the pubis bone to that femur. And second muscle adductor brevis, this originates from the inferior ramus of the pubis and inserted to the superior half of the linea aspera of the femur. And that other muscle is known as adductor magnus. It is a large muscle of this medial compartment, originate from the inferior ramus of the pubis and ischium to ischial tuberosity, inserted to the linea aspera of the femur. The other muscle is known as the pectineus, arising from the superior ramus of the pubis and pectineal line of the femur between the lesser trochanter and linea aspera. And this other muscle is known as the gracilis. It is the most medial muscle. It is the only muscle of the adductor compartment which is not attached to the femur, which is it arising from the medial margin of the body of the pubis and inferior pubic ramus and inserted to the upper part of the medial surface of the tibia. So this is the most medial muscle, and all these medial compartment or adductor compartment muscles are arising from the pubis bone. And the other muscle is known as the obturator externus. It arising from the obturator membrane and adjoining anterior and inferior margins of the obturator foramen, inserted to the trochanteric fossa of the greater trochanter of the femur. So all these muscles of the medial compartment inserted to the femur, except gracilis muscle, which is inserted to the medial surface of the tibia, along with semitendinosus and sartorius muscles. Now coming to the posterior or flexor compartment of the thigh region, known as the hamstrings. So the hamstrings are so named because their tendons are long and string-like in the popliteal area, because the hamstrings span two joints, hip and knee joint. They are both extensors of the thigh and flexors of the leg region. The muscles of this compartment, biceps femoris. This is arising from the two heads, that is the long head arising from the ischial tuberosity, short head arising from the linea aspera of the femur. And this muscle is inserted to that fibula, that is head of the fibula and lateral condyle of the tibia. And that next muscle is known as the semitendinosus. It is so named because its lower half is tendinous, arising along with the long head of the biceps femoris and from the lower medial portion of upper quadrilateral area of the ischial tuberosity and inserted to the proximal portion of the medial surface of the tibia. So this is that semitendinosus. And other muscle is known as a semimembranosus because it is a broad muscle and it is a half membranous, arising from the upper lateral quadrants of the ischial tuberosity and inserted to the medial condyle of the tibia. So this muscle is known as the semimembranosus. So all these compartment muscles are arising from the ischial tuberosity. So ischial tuberosity, if you divide into two compartments, in the upper compartment, that above that upper lateral portion is arising from the semimembranosus. Lateral portion is arising semitendinosus and long head of the biceps femoris. So all these muscles together known as the thigh muscles. So at a glance, the thigh muscles is divided into three compartments. Anterior is having sartorius, quadriceps femoris, including rectus femoris, vastus lateralis, vastus medialis, vastus intermedialis, and small muscle is known as articular genu. Posterior compartment is known as the flexor compartment, known as hamstrings. The muscles are semitendinosus, semimembranosus, biceps femoris, and adductor magnus. Medial or adductor compartment muscles are known as adductor longus, adductor brevis, adductor magnus, and gracilis, pectineus, and obturator externus. The nerve supply of this anterior compartment is known as femoral nerve. The posterior compartment is a sciatic nerve. Then medial compartment is known as obturator nerve. Coming to the leg region, as like thigh region, leg region is divided into three compartments. Anterior, also known as extensor compartment. Lateral, also known as peroneal compartment. Posterior, also known as flexor compartment. The leg muscles of each compartment are: anterior compartment, there are four muscles: tibialis anterior, extensor. It is called extensor compartment. That's why the name starts with the extensor. So, extensor hallucis longus, extensor digitorum longus, peroneus tertius. The next, posterior or flexor compartment, the muscles known as divided into two, that is superficial group and deep group. So this superficial group muscles is known as the calf muscles. The superficial group muscles known as the gastrocnemius, soleus, plantaris. The deep group known as the popliteus, flexor digitorum longus, flexor hallucis longus, tibialis posterior. And the lateral or peroneal compartment is known as peroneus longus and peroneus brevis. The nerve supply of this anterior compartment is known as deep peroneal nerve, whereas posterior compartment known as tibial nerve. Lateral compartment is known as superficial peroneal nerve. So this is a glance about this leg muscles, the three compartments and their muscles and nerve supply. Coming to gluteal region muscles, the muscles of the gluteal region is divided into major and minor groups. The major muscles of the gluteal region known as the gluteus maximus, gluteus medius, gluteus minimus, and tensor fascia lata. The nerve supply to this gluteus maximus is known as inferior gluteal nerve. Medius is known as superior gluteal nerve. Gluteus minimus, superior gluteal nerve. Tensor fascia lata by superior gluteal nerve. Coming to minor muscles, the piriformis nerve supply is by ventral rami of S1 S2, superior gemini muscle now to obturator internus, inferior gemellus now to quadratus femoris, obturator internus now supplies now to obturator internus, quadratus femoris is now to quadratus femoris, obturator externus, posterior division of the obturator nerve. So these are the gluteal region, the muscles. Coming to muscles of the foot, muscles of the foot is divided into four layers. The first layer, second layer, third layer, and fourth layer. The first layer muscles are known as flexor digitorum brevis, abductor hallucis brevis, abductor digiti minimi. The second layer muscles are known as flexor digitorum accessorius, four lumbricals, two tendons, that is flexor digitorum longus, flexor hallucis longus. Third layer muscles are flexor hallucis brevis, adductor hallucis, flexor digiti minimi. The fourth layer muscles known as that interosseous muscles, that is three plantar interosseous, four dorsal interosseous, and tibialis posterior tendon coming from the posterior compartment of the leg, tendon of peroneus longus coming from the lateral compartment of the leg. So these are all muscles of the foot, and these muscles of the foot now, and the nerve supply of the first layer is by that medial plantar nerve and lateral plantar nerve. Second layer muscles by that nerve supply lateral plantar nerve, lumbricals by the medial plantar nerve, first one, others are by lateral plantar nerve. The third layer and fourth layer, the nerve supply of fourth is that plantar and dorsal interosseous by plantar nerves, tibialis posterior by tibial nerve, peroneus longus by superficial peroneal nerve. Whereas third layer by flexor hallucis brevis by medial plantar nerve, and the remaining two by the lateral plantar nerves. So these are that four compartment and that whole thigh, leg, gluteal and foot muscles, and all these muscles together are helpful for this brief and quick revision for this lower limb muscles. Thanks for listening.